First, I would also like to personally thank Dr. McSherry for being such a great research advisor, and Dr. Diamond and the whole Honors College for being so supportive during the conduction of my study. Okay, so today I'm presenting my study on mood and risk for depression among college students, comparing those who are living on campus versus those who are living at home. So depression was one of the factors that was aimed to be studied in the research because this is a fairly prevalent condition in primary care setting and general hospital settings. And the college students was a chosen sample population because, as you can see, so depression can impair the academic productivity of students. And according to the transition theory model by Malaysia and Chick, transitioning alone into a college environment can be a big stress factor and a precursor for other health problems. And so when a student transitions in the whole new environment with new people and strangers, the feeling of homesickness can occur because majority of their college years are spent away from their families and old friends. And according to one of the studies, homesickness has a relationship with depression. And according to Martin and his colleagues, depression can be a preceding factor for several complications, which is why it's very significant for the factors of depression to be studied, because in nursing we know that prevention is better than attempting to cure. So the research question for my study was that among college students, does living on campus have an effect on mood and risk for depression compared to living at home? And following that transition theory model, I hypothesized that students living on campus will have a negative mood and higher risk for depression, and inversely, students living at home will have a positive mood and lower risk for depression because they don't go through as much transition as those who would move on to living on campus. And there were several literatures that had provided evidence to the importance of researching about mood and risk for depression on college students. One study that was conducted in Pakistan had found the prevalence of anxiety and depression were at a higher rate among dormitory students than the home resident students, which is why I wanted to compare the two groups. Also, another study found that depression had accounted for the variance in exam marks. So it was clear to see with that article that depression really had an impact on the students' academic success. And I had mentioned before about homesickness, that it was been found that it has a relationship with depression, and a study found that 80% of the students surveyed in the UK had reported feeling homesick. So with all that in background, I wanted to conduct a non-experimental cross-sectional quantitative study, and during the study I utilized two instruments, which was the positive and negative affect schedule, or the PANA scale, which measured the mood in college students. And the second one was the brief patient health questionnaire, or the PHQ-9, which measured the risk for depression. And these two tools were found to have strong reliability, so they were very reliable while I was using them throughout my study. The way that I determined whether they were living on campus or living at home were from the demographic survey that they had taken along with the two instruments. And now, in order for them to be eligible to participate in this study, they must be at the age of 18 or older. They must read, write, and understand English. They must be currently enrolled in a college or a university, and they must have no previous or current diagnoses of depression and or mood disorders. So after I conducted the study in the university, student center, and residence halls, I was able to get back 110 total questionnaire packets that had fit in the inclusion criteria. 47 of them were from students that lives on campus, or off campus, or who lives at home. And 63 of them were from the students that lived on campus. And so after I collected my data, I had organized it using the SPSS software, and the independent sample t-test method was the specific method that was used to compare the difference between the two populations with the dependent variables, which was the risk for depression and mood. So after analyzing my data, my study found no significance on risk for depression between college students that would live on campus and college students that would live at home. There was also no significance found on mood between the two groups. However, there were several other findings that had been found with the other demographic factors. My study found that female gender and risk for depression was statistically significant, meaning that the female gender had a higher risk for depression than the male gender. Age was also found to be negatively correlated with negative mood, meaning that as age increased, negative mood decreased. And lastly, a positive correlation was found between negative mood and risk for depression. So as negative mood increased, the risk for depression also increased. So my study did not statistically support the hypothesis in the beginning, meaning that students living on campus was not found or was not proven to have a negative mood and higher risk for depression than the students who are living at home. There are several, although the transition theory model had supported the original hypotheses, there are other factors that may need to be considered in the future. And these factors were the limitations that were found towards the end of the study. The limitations include that my study had a small sample size. Typically, this type of study would have a larger sample size. And American culture influence, living conditions such as family dynamics at home, and relationship with a roommate if they were living in the residence halls. And also, employment influence could play a role, whereas one job may have a higher stress level than another job, regardless of the hours worked. Although this specific study did not yield statistically significant proof for my hypotheses, it did bring about the factors that can be later on considered in future studies. And future studies that would include all of, or most of these factors could yield different results and could help determine proper interventions that could decrease the rate of depression and the possible complications that it can cause in the society. That's all questions, and that's the end of my discussion. Any questions? Christine?
Did you have any other findings?
Other than the three that I had mentioned earlier, well, there was another one with positive mood and risk for depression, but it was not statistically significant. It was close, but as Dr. Machado said, you can't be slightly pregnant, so you can't be slightly early.
Good, the nursing faculty has got that sorted out.
Anybody else have a question?
I wonder, the original research you looked at from Pakistan and Britain was talking about the fact that there was a greater risk of depression. And I wonder if that's because in the U.S. going away to college is so normative. And I don't know about Pakistan, but certainly in Europe, I think it's much less common. More people tend to stay home and go to college. So
Right.
we seem to have a lot of resources in place to help people make that transition.
Right. That's why I had included that the American culture would need to be considered in the future, because I've seen that, although it wasn't significant, I did see a lot more kind of a positive mood with people who are living on campus.